Hello, everyone. I'm Ron Rolfing, your host of the ACAP Preferred Education Series, and I'd like to welcome you to our latest session presented by Itiliti Health. Our presenters today are Michael Lunzer, founder and CEO of Itiliti Health, and Amy Skazwak, Senior Manager of Medical Review with Blue Cross Blue Shield of Wyoming. And they're discussing how your organization can streamline prior authorizations and reduce the burden of prior auth by 30%. But before I get things started, I do have some things I need to cover. This webinar, along with all ACAP calls and webinars, will be held in accordance with the ACAP antitrust guidelines. And these guidelines can be viewed on our website. We will be recording today's call, and we'll post the slide deck and recording on our website by tomorrow morning. The link to these items can be found in the invitation sent to you for this webinar. And please remember, if your plan is looking for a vendor, be sure to check out our list of preferred vendors on our website. Just look to the top of our homepage and click on the preferred vendors link. And you can also post a note, an RFI, or even an RFP on the preferred vendor connection portal. And of course, during today's call, you can ask a question at any time by clicking the Q&A icon in your Zoom window and typing in your question. And all questions will be answered at the end of the presentation. Now, I'll pass it over to Michael and Amy. Michael? Michael and Amy, it's all yours.
Ron, I think Mike might be having some technical difficulties.
Okay, yeah. Let's see if we can work on that. Please bear with us.
Bear with me.
Okay.
There we go. Now I can run.
Okay, now it's all yours. Go ahead and get things started.
Just making sure we can hear Amy.
How are you, Mike?
There we go. I can hear you as well. Okay,
Perfect.
we're good to go. And Ron, I'm sorry, did you do a quick introduction for us already?
Yes, I did. We're all ready for you to get going.
All right. Sorry about that. I'm not sure what our audio issue was there, but I'm glad we got that solved quickly. So thank you very much for giving us the opportunity to present to the ACAP group here today, Ron. My name again is Michael Lunzer, and I'm the CEO and founder of Itiliti Health. And we're excited to talk with you today about some work we did in conjunction with Blue Cross Blue Shield of Wyoming that has a pretty significant impact on health plan administrative burden around prior authorizations, and an equal, if not greater, impact on provider relations and provider support activity. Just to talk a little bit about the specific topic we're going to address today before we get into the Q&A section of our discussion. This is a quick graphic that shows the typical process of prior authorizations from a provider creating an order for a procedure. An administrator at the provider organization goes in to schedule that procedure. As part of that process, they want to go look to see if a prior authorization is required. At that point, they typically document the prior authorization request and submit that to the payer. And of course, then the payer reviews that that submission and approves or denies that requirement. Now, what typically happens, we're going to talk a lot about the is auth required portion of the process today. What typically happens is somebody from the provider organization goes to look and see on the health plan's website if they can understand the rules, or for a specific patient, for their medical policy, medical plan that they're under, if a prior auth is required. And usually they'll go out to the health plan's website and find a slew of PDFs and spreadsheets that are intended to communicate whether or not a prior auth is required. But obviously, oftentimes there's a lot of different health plans that the health insurance company offers, and that makes it very difficult for the provider to determine for sure which plan are they on and which set of rules are they going to go by. And so what we're going to talk about today is the PA Checkpoint product that we implemented for Blue Cross Blue Shield of Wyoming. And that product makes it really easy for the provider to know if a prior auth is required, and also provides a means for the health plan to administer those rules in the system. It's delivered as a software as a service tool, and is exposed in multiple places for the health plan. Itiliti Health has a number of other products. We're not going to talk about those today. We can cover them a little bit at the end, and if you have questions, we can address some of those. But again, today we're going to focus on PA Checkpoint. One other note about PA Checkpoint is it also fulfills the role required for the coverage requirement discovery tool. So that aligns with the new regulatory proposed regulations from CMS that are going to require a prior authorization API. And again, as part of that API, there are 3 transactions that prior auth is broken out into. And the first of those is called coverage requirement discovery, and PA Checkpoint is the database that a health plan can use to address those transactions. So with that, we're going to shift over to a little bit of a conversation here between myself and Amy. And the purpose of our discussion today is really to make it easy for you all to ask questions, and for us to dive a little deeper into Blue Cross Blue Shield of Wyoming's experience in using PA Checkpoint. So with that, I'd like to ask Amy if you could tell us just a little bit about Blue Cross Blue Shield of Wyoming, and the number of members you have, and the types of business that you perform, and the size of the organization.
Absolutely. Thank you. And thank you for having me as well. So Blue Cross Blue Shield of Wyoming, we are a not-for-profit Blue plan. We operate in the state of Wyoming. We insure about 115,000 lives. And then we also cover additional lives for other Blues plans where their members live in the state of Wyoming. So typically, we're trying to communicate and administer plans for approximately 150,000 lives. We sell commercial insurance, which includes on-exchange insurance and self-funded clients. We also offer the federal employee program.
Great. And when you started looking at this area, what was the big problem that started your interest in solving a problem? What was the problem that you were dealing with?
Absolutely. So I think that anybody on this call, whether you're a payer, a provider, or you yourself have tried to work through the prior authorization process just in healthcare in general, you know that the prior authorization process is cumbersome. And there will always be a debate in our area as a payer as to, is prior authorization a barrier to care? And so as a plan over the last, I would say 3 or 4 years, we've really tried to take a look at how can we make this an easier, more efficient process. And so when we started to dive into prior authorization with our provider community and our internal staff, we identified that one of the major areas of concern was, are we providing the correct information to the providers in a real-time manner? And is that information correct? And so as we started to look at that, we found that as a plan, we had discrepancies in our data because we didn't have a tool that truly maintained all of the rules of prior auth that our member services staff could leverage and give our provider community the right answers. We also didn't offer a tool that was provider facing or real time. So like many plans, we had a sheet on our website or a web page where you could view some static text that was not at the CPT code level, very general, very basic. And our provider community, as well as our internal staff, said this is not adequate. And so we entered the market to look for a vendor who might be able to assist us with those issues. And that's when we met Itiliti Health and started to go down a road of saying, what tools can you offer us that might address these situations?
And was there a specific problem or pain that lack of up-to-date or difficulty maintaining the information created for you?
Absolutely. So when you start just at the top of that list, we see provider and member abrasion. If you're not receiving the correct information, there's an immediate downstream impact. When you go further down the continuum of care, we get into claims payment. And there is no member or provider out there that wants to see that they've had a procedure done, they thought it didn't require an authorization, and then you have a claim that's denied or impacted based on that decision. We also found from an organizational level that when we are misquoting items, now we're putting ourselves at risk as a payer to now need to cover those claims or that claim expense. And that may not be necessarily the expense that we're wanting to pay because we're administering for clients like the federal employee program. Those aren't truly Blue Cross Blue Shield of Wyoming's dollars. This is somebody else's dollars. And so those misquotes were a risk to the organization. And so really, when we were looking for this tool, it is how can we minimize that risk, not only for ourselves as a payer, but also the risk to our members or providers of having services rendered and then having a claims or financial impact.
Interesting. And so did you look at solutions that you could provide internally versus externally? And what were the various types of approaches you thought about in terms of addressing this challenge?
Absolutely. So internally, for years, we've held some databases that were created by our technical staff at the plan. And what we found is that they were not easy to update and keep up to date. And there's always the challenge of different lines of business have different authorization requirements. So really understanding when you have member A versus member B, are those requirements different? And how do you tie in that membership? And so I think for a lot of whether it's payers or providers, it's tough to understand commercial insurance versus federal insurance versus Medicare, Medicaid. There's so many different rules. And so we struggled with that internally trying to create a tool. And we found that we just did not have the infrastructure to really create something that worked. When we went out into the industry and tried to look for a vendor who offered something, we saw a lot of tools that were very simplistic. If you have a CPT code, if you have a service, does it require authorization? Yes or no. But when you got into the intricacies of what about for member A versus member B, or for line of business, commercial versus Medicare versus Medicaid, many of the tools we looked at didn't have that sophistication. And I think that as an industry is where we all suffer from the confusion, is that difference between member A and B or payer A and B. And so that's where when we looked at Itiliti, they were offering that solution. So their solution includes the ability to show at a CPT code level or a HCPC level, that service description, for a specific member, a yes yes or no view of does this require authorization or not. And that is really what helped us to find that this tool was going to meet our needs.
And can you tell us a little bit about the implementation process that you went through to bring Itiliti Health's PA Checkpoint live?
Yes. So as a small plan, we have a very small footprint in terms of the infrastructure of the plan. So at the plan level, we have approximately 200 staff members, of which we have an IT department of approximately 10. So whenever we are looking at a vendor and we're looking at something that is technical, the first aspect we look at is, can we do this as a plan? And one of the items we found very helpful with Itiliti was there was never a question of if we could do it. It was a partnership. So it was, if you don't have the resource, we're going to help you figure out how we get this done. And so when we started down this path, we found that Itiliti really supported us from an infrastructure perspective for IT support to say, okay, how do we do this? When we started to meet with them, we found that this was very simplistic. We were using things that most of us in our day-to-day business are using. So we're leveraging things like Excel. We're leveraging things that were already built at the plan. So Itiliti was very helpful in saying, okay, if you need rules at the membership level that says, you know, what is member A requirement versus member B, what report do you already have created that we could possibly leverage, instead of asking us, Blue Cross Blue Shield of Wyoming, to conform to something that maybe a larger entity might easily be able to. So we found that Itiliti was very willing to work with us on that implementation and made it very simple. Every step of the way, we had a project manager from Itiliti that was supporting us, meeting with us on our schedules, and was able to really help us through from the beginning to the end of implementation. I would say that from an implementation standpoint, the team at Itiliti really did help us to understand, what is your vision? What are we solving for? And to let us really lead on the, do you want the bells and whistle model, or do you just need to solve a problem? And for us at Blue Cross Blue Shield of Wyoming, we really started with, we just need to solve a problem. And Itiliti really helped us implement just those pieces and let us really have a day two or down the road version of maybe some additional product offerings or additional steps that could be utilized. So that helped us to shorten our implementation timeline and really meet that immediate need.
And I'm a little familiar with the steps that were taken as we implemented maybe internally versus externally and such. Can you share a little bit about the deployment process in terms of who got access to the tool and through what means over time?
Absolutely. So initially we piloted Itiliti with our medical review and our member services staff. And that was to help ensure that at the payer level or at our organization level, what we were quoting was how claims or authorizations were reacting. We did that pilot for approximately 3 months, and we found that things were working. We were liking the results that we were seeing. And we then opened that up organizational wide. So whether you were in provider relations, working with a provider directly, you were in our client services area, maybe out selling products to a new group or client, member services, medical review, our actuary team, our auditors, really anyone in the building had access to it and still does today. We then, after we felt comfortable at an internal perspective, which was about 6 months, we hadn't had any issues. We then opened this up on our provider portal, which we use Itiliti for. And now our providers have real-time access to enter 3 simple pieces of data and return that answer in real time that's specific to that member. So for our provider community, if they have the member's contract number, which they should have on file, they have a date of service, and they have a CPT code, they can type that in, click enter, and they have a yes or no displaying on their screen. And so for our provider community, we believe that's one of the major gains of having Itiliti. We heard great feedback in that I no longer have to call you. I don't have to ask a question unless there's something more that I need help with. It streamlines this for my frontline staff. So maybe it's your schedulers, maybe it is your billing specialist, maybe it's an authorization specialist. Those individuals have so many items on their desk, especially in a rural area like Wyoming. Our providers have maybe one person in a provider office who's working on this. They don't have time to sit on the phone. They don't want to be doing that. They want to be able to quickly document that. We also have found that it's very easy for providers to take a snippet. So when they want that piece of paper, they want something that allows them to say, I did see this on this day. This is my documentation for their backup for payment. It offers that ability to really use any capability to document that. The tool also has some documentation that's available to help providers see what transactions they've had. But we have found that truly the snipping tool has been something that they find very easy and most people know about. So it's allowing our technology and the technology that a provider may or may not have to work together to fit everybody's goals.
So it sounds like PA Checkpoint has kind of become the source of truth internally and externally about prior auth rules and requirements. How do you administer the tool and how difficult is that?
So in terms of our business, to kind of give everyone an idea of what we're managing, we currently have approximately 2,000 individual CPT codes that are under prior authorization for one reason or another. We have 27 variations of rules. So there's at least 27 differences between lines of business or different employer groups. And we allow changes to the authorization tables once a week. So we could have codes flowing in or out up to weekly. With that, we're able to manage Itiliti Health with one employee, and we allocate 25% of her employment time to Itiliti. So a fourth of an FTE is what we are able to manage it with today.
That sounds really, really effective. How has this tool impacted your call center and maybe staffing levels and things like that?
So when we implemented Itiliti, initially we did have about a year, I would say, adoption period where our providers were leery. It's a new tool, it's a change. Even if I'm using it, I still am going to call you and see if you say the same answer. I would say when we moved into year 2, that's where we really started to see a difference. We did not see a large reduction in calls from our providers, but what we did see is a large reduction in calls that included the question, is authorization required? And that was a huge change for us. So what we did see is things like first call resolution and average speed of answer times that had increased metrics. So we were now not talking about why is the information different? Why am I getting different answers? Where is the source of truth? We started to see those types of questions and issues start to resolve themselves. And we really have moved into a place where when a provider calls about an authorization question, it's because it's in depth. There's something different about the service. There's something unique about the situation or member instead of a general question. That has allowed our member services area to really spend time on what matters instead of something that's maybe simplistic. And again, the provider community over and over again has always told us, I don't want to call for things that should be automated, that are easy questions. And so this has really helped us with the provider community in this area to say, you know what, we're moving forward and we've got this piece under control. And that allows us to start working with them on different initiatives like, should a service require prior authorization, and spending our internal resources there instead of trying to maintain a homegrown tool or pick up the phone to answer simplistic questions and spend more time on those other questions.
And how has the product been received from providers? Have you received much feedback, and what kinds of perspective have they shared with you?
So initially, we had really good feedback after the first year. Really, there was that leery adoption point. I think anybody has difficulty with change. So year two, we started to hear things like, this is working. I very much enjoy the tool. I think the real-time aspect is very helpful. I think for any provider, it's always I want to see the results. And so seeing claims that are paying in accordance with that information that they're seeing has been very well received. Now we're starting to receive feedback, and I think this is where the industry in general is going, is I want more. So now it's starting to talk about, okay, if I do require authorization, can you tell me more about what's required? So can you talk to me about the medical policy that might be key here? Or can you tell me about the instances when maybe you want to see an authorization versus maybe you don't? Maybe I can just go ahead with my claim without receiving that prior authorization. And so now we're starting to move towards a phase 2 approach, which says, how can we share more information, be more transparent, be more of a partner to our providers now that we've have that base layer, that foundation established?
Are there any financial metrics or measurements or outcomes that surprised you?
I think that one of the areas that may not have surprised us, but we were hoping to achieve, was the reduction in the amount of claims that Blue Cross Blue Shield of Wyoming was covering out of, if you will, our bank account due to misquotes in our customer service area. So typically, we were recording that we would have approximately 10 to 15 misquotes per month, and then we would quantify that based on the claims payment. And so you could have anything from $100 visit or something to, $100,000 medication. And so those numbers varied. But what we did see is now, when we look a couple of years later and we're in the tool and COVID is not upon us and we have normal utilization, we typically have less than one misquote per month. So it's very rare that we're seeing any misquotes that are coming through from our providers, where we're seeing an appeal where they state, your tool gave me information and my claim did not process accordingly. And so we see that as a metric of almost complete success. And when we do have a misquote, that's something that we're doing internally. That means we've missed something. It's not the tool, it's the infrastructure. But we're finding that when we're managing thousands of CPT codes, multiple types of coverage and different rules, having less than one misquote per month, we find as a true success.
And would you be comfortable sharing any kind of financial impact that that's had on the business?
Yes, so I think we can specifically say that when we started, we were typically looking at misquotes ranging from about 500,000 to $1 million per quarter. Now that we are seeing, less than one per month, right now for year to date, we have misquotes under $5,000. So we're seeing a huge decrease in that payment model where we're having to cover claims.
Wow. And are there any surprises that weren't positive? Are there any negatives from the tool?
At this point, I don't think that we've seen any negatives. I think that we've learned, like with any vendor implementation, things along the way. So when we initially started, we thought, for instance, uploading our membership data once a month would be sufficient. And we quickly learned that insurance coverage fluctuates more than once a month. And so we've now gone to once a week. That's something that, again, we didn't think that would be something that we would need, but we found that we did. Even with those changes that we found in having Itiliti as a vendor, we still, again, are using that one FTE 1/4 of her time, so approximately 10 hours in a 40-hour working week. So we find that just that maintenance is absolutely doable. It's easy. And Itiliti really helps us with any issues that come up. So anytime we have an issue, we're able to resolve it very, very quickly. That's something that typically, in my experience, I find working with vendors, usually it's a long, drawn out process. There's a ticket, there's a phone call, we'll schedule a meeting, there's 10 steps. With Itiliti, we have found you send an email to a person, someone who's on your account, someone you're working with on a regular basis, and they really take a problem and handle it for you. So of course, there's always something that we need to do on our side typically, but it is easy for us to get things fixed. I think that's a huge surprise to me for a vendor relationship because it's just not as typical in our industry.
That's great to hear. In terms of, I'm going to share a document that I'm curious to get your thoughts about. We had another health plan that after implementing the Itiliti Health PA Checkpoint product saw a really significant reduction in call center traffic, as well as shorter call times in the call center. And then they also saw a reduction in submissions for prior authorizations for things that did not require a prior authorization. Is that similar to your experience, or do you have differences in what you found in those categories?
No, I think we're very similar. I think we definitely reduced prior authorization call traffic. Again, we're still seeing provider calls, just the questions have changed. Call center shortened call time, absolutely. When you decrease a question or something you don't have to look up, don't have to talk about, it goes down. Those disputes are absolutely reduced. That's that less than one per month that we're seeing. And then prior authorization submission reduction, I don't think that we've achieved necessarily the metric that Minnesota has. I think that in our area, we service a lot of out of area providers that still require items or maybe require it as their backup because maybe another plan area or another payer in their area requires an authorization. And so they want that backup with us saying, truly we don't. But I think for our local providers, we definitely did see some prior authorization reduction.
That's great. Well, I don't have any other questions for you, but I'm gonna shift the dialogue here a little bit, and we'll talk about get into a little more of the specifics and show kind of what it looks like to perform a prior auth check through PA Checkpoint. And at that point, feel free to comment. So I'm just going to actually pop out to my browser, and I'm assuming you're seeing my screen at this point. And so just to kind of clarify, what we oftentimes see from providers is that when they're performing a service, they Google the health plan name, and when they click on the link, what they're looking for is some kind of a lookup tool or a grid. So in this case, this is Blue Cross Blue Shield of Minnesota's public website. They share this on their public website. Amy, just to clarify, you're seeing the public website right now, right?
I am, yes.
Okay, good. So on the Blue Cross Minnesota public website, they have the prior auth lookup listed. And this is actually the Itiliti Health PA Checkpoint product that powers their public version of this tool. And so at that point, the provider can come in and enter an NPI, group number, date of service, and multiple procedure codes. And when they submit this, they then see a very clear answer back that identifies that in this case, 2 procedures require prior authorization, 3 do not. They get a transaction ID, that print screen that you were speaking about. And then they also get kind of confirmation of the information that they requested. I'm curious, Amy, in our case, the date of service shows the rule for that specific date of service for the provider. Do you find that to be valuable in your world?
So we do. So as a payer, on many of the plans that we offer, there are benefits that can change, and they're not all on 1-1. So what we find is that benefits, as they're changing, we can enter Itiliti and say, for today, it doesn't require an authorization, but maybe for tomorrow it does, or vice versa. And so it allows our provider community to know, based on truly the date that they're rendering that service, what is the rule. So we're not quoting what happens today, and then that changes tomorrow.
And how about looking back? The Itiliti Health tool is also accurate in arrears. So if you want to look at what the rule was 6 months ago, you can do that as well. Has that been a valuable component maybe for internally as you look at disputes or claims questions?
I think it is valuable both internally and externally. So one of the items that we find, and I'm sure many providers also find, is that when we're talking about claims billing, we're not talking about typically billing on the date of service. It takes a while for charges to come through, for those claims to be completed, to make it through clearing houses, validation errors, coordination of benefits, just so many different things. And so by the time that a claim cycles from when it leaves a provider to when it's truly paid through the payer, that's not always a short process. And so sometimes we do need to look back and say, let's refresh our memory and what were we doing on this date and what was required or what wasn't. And that helps us to bring this picture all together when it comes to prior auth.
That's great. So again, just to talk through a couple more things we see here. So you see at a CPT code level, what things require prior authorization. We also have the ability to put a hot link in here for the specific medical policy that applies, as well as for additional instructions. So in this case, particular product is the preferred product. Does your organization use the instructions capability to kind of give extra guidance to your providers in your current implementation?
We do. We find the additional procedure information to be very valuable. Many times a yes or a no doesn't give the whole story. And so we find that additional procedure information to be extremely valuable. So an area we initially implemented it in was the prophylactic space. So for instance, a prophylactic mastectomy might require a prior authorization at our plan to ensure that it's not cosmetic in nature. However, if you're having a mastectomy due to a cancer diagnosis, that is federally covered, it does not require a prior authorization. So to be able to say mastectomy, yes, in the tool requires an authorization, but then to note to a provider, if you're going to submit with a cancer diagnosis, authorization is not required. It's very helpful, and it does reduce that burden on the provider for submitting, and it reduces the burden at the plan level for not having to process that authorization.
Great. Is there anything else you would share about the application as we're looking at this screen, before we move on in the discussion?
I think, Mike, one of the things I would call out here is that for us, our providers really like how simplistic it is. There's not, if you will, over information. There's not over graphics. It's just very clean and simplistic. And I think that in our industry today, finding something that's simplistic in viewing information can be difficult to find. And so I think that is one thing that we have really tried to maintain with our additional procedure information. But I think the tool also tries to maintain that very simplistic look, that there's no question about what is it trying to tell me. It's just yes or no, it's required, it's not. The colors seem to work with that messaging. And so we've found great feedback in terms of that.
Well, that's super. Couple other key points about the PA checkpoint. Again, it can show up as a web resource. It can show up within the payer's public website, the payer's provider portal, as you've described in your Itiliti site. If a provider wants to, they can integrate Itiliti Health into their EMR with a 278 transaction. In the near term, we'll start to see electronic medical record systems supporting the FHIR CRD transaction, which would then allow them to talk to PA Checkpoint inside of their EMR. And then, of course, there's an admin portal, which is where your organization can come to administer your rules. Is there any other comments about the admin portal or reporting or any other aspects that you would comment on?
I think that for us today, I think we use the payers provider portal, and that has worked very well for us because it's able to implement the tool where our providers are used to going, and it makes it a one-stop shop. So we can view remittance advices, the actual authorizations that were submitted, and those rules in one spot. I think that's been very helpful to our provider community. I think that Blue Cross Blue Shield of Minnesota has put it on their public-facing website, and I think that that's something that we are interested in possibly in the future. I think that that just helps with transparency, especially if you're not in the provider portal. And I think that this PA Checkpoint tool really does help us as we start to envision what those rules are for 2026 mandates that we all know are coming for prior authorization, to say this is something that's there. It is something that our providers can use, they're used to, and possibly helps us to bridge that gap to those new requirements.
And again, the product is provided as a software as a service tool and intended to minimize the IT requirement on your side. Has your IT organization had any comments or thoughts about PA Checkpoint at this point, or how's it work for them?
So I will say that our IT department loves PA Checkpoint because they don't have to do anything with it. So at implementation, other than ensuring that, proxies and firewalls and things of that nature were set up, there was nothing else for them to do. And to date, there really isn't. So it's something that's administered completely through our operations team. And again, it's very simplistic and it's very user-friendly, easy to use. And we really couldn't say anything more about how easy it is to use.
Great. So I think that covers the majority of the topic around PA Checkpoint. I have a few slides that I can go through to share a little more information about Itiliti Health and our products. But I just want to remind everybody that there's a chat functionality in the system. So if you'd like to enter a question for Amy or myself, we'd be happy to answer those once I go through a few slides about Itiliti Health. So give you a few minutes to enter some questions while I talk about Itiliti Health, and then we'll dive into those questions. So we do have an ROI calculator for the Itiliti Health product, and it predominantly addresses the administrative savings that we've seen at other health plans and through what we just talked about with Amy. And we'd be happy to talk with you and walk through the ROI calculator with your organization. Just a little bit about Itiliti Health. We were actually founded inside of Blue Cross Blue Shield of Minnesota in 2018, where we found that there were some things we had done, the health plan had done, that were really great starts towards automating and streamlining prior authorizations. So Itiliti Health was spun out of that effort. And since then, we created a platform that handles all of the rules of the health plan in terms of prior authorizations, as well as the ability now we've added some functionality to capture full medical policy data and a lot more, which I'll show you in a second. But the strength of the PA Checkpoint product as well is that it covers all lines of business, all products within each line of business, and it isn't limited to one clinical area. So all outpatient medical prior auths and specialty pharma tend to be what it's used for. In 2022, we did over 2 million PA checks through the system, where providers asked the system if a prior auth was required. Interestingly enough, about 70% of the time, we come back and tell the provider a prior auth is not needed. which kind of tells you that they're curious and they want to know this information. And so those are, telephone calls and other inquiries that might have taken place had they not come to the website. Because of that, we've seen some great response from Gartner and IDC as they've spoken about Itiliti Health. And then recently we won a class Points of Light Award for our work with Blue Cross Minnesota, Avality, and Mayo Clinic, who uses this tool inside of their electronic medical record system. So this is just a quick view of the products that we offer. What we've been talking about is PA Checkpoint. On top of that same database, we offer a medical policy management capability, which is essentially a content management tool that's married with the database that helps the health plan manage the workflow around medical policies and changes. And then once a medical policy is approved, it's automatically exposed to the provider community. We have a routing product which leverages the database such that when a prior auth is submitted, it's delivered to the right destination, be that an internal prior auth decision group, or in many cases, health plans have external groups that perform prior auths. So we route the prior auth to the right destination. We have an automatic authorization rules capability, which essentially means that the data that's submitted on the form with the prior authorization is what's used to determine whether it's approved, pended, or another way decisioned. And then on the top of the stack here, we have what we call clinical adjudication, assistant, and automation, which is where we start to look at the medical record from the patient and start making decisions based upon what's in the medical record itself. I spoke just briefly about the fact that there's the new CMS proposed regulations coming. They were proposed in December. We're anticipating those to be codified sometime yet this year, and it requires this prior authorization requirements, documentation, and decision API. And as I mentioned, it kind of breaks out the transactions that are part of prior authorization into three categories. Itiliti Health has products that address all three categories. And we're excited to see the electronic medical record system companies starting to embrace these transactions, which means that we won't have to build and you won't have to convince your providers to deploy some special piece of software. Most likely those requirements will be inherently supported inside of the EMR. But as another point, Itiliti Health sees that this transition from where we are today with telephones, faxes, and websites to a wonderful world of FHIR is going to take time. And so all of our products are designed to support this transition period. In other words, providers that use the telephone to call your call center will get the benefit of PA Checkpoint, those that are on the web, and similarly, it will work in the FHIR future world. And that applies to all of our products, PA Checkpoint, PA Medical Policy Management, and PA Complete Clinical Assistant. So next steps, we'd love to have you reach out to Itiliti Health, and we'd be happy to give you a one-on-one demonstration, as well as we've started to work with a consulting organization and are offering some initial assessments of health plans, infrastructure, as well as medical policies and structure to help them kind of refine and evaluate where are they from a medical policy and a prior authorization perspective in terms of their optimization of prior authorization and readiness for the new regulations. And so again, that's a free service that us and the consulting organization are willing to offer, and would love to talk with you about that. And so with that, I'd like to answer questions that maybe you have, and we do have one question in the Q&A. Amy, they're wondering, how long did it take for the full implementation of the product?
So when we started our implementation journey, so I'm going to say the timeline I'm starting with here is after all the contracts are signed, because we all know legal takes a little bit of time. So when we started having our implementation meetings to when we implemented that in our call center and our medical review staff, so that first line wave, it took us about 90 days. So it was very quick. In terms of implementing it into our provider portal, so having Itiliti work with Availity to put that into that piece, that took us a little bit longer, just based on the coding of that behind the scenes, and that took us about 6 months. Now we knew that going in. So when we talked about our roadmap with Itiliti, Itiliti was the first one to say on day one, even though you're not ready, let's start talking about it. And so they started really talking to Availity and getting that done so that we had a date where we wanted to implement, and everyone was on the same page and able to meet that date. One of the other things I think we touched on earlier is that Itiliti always had a project manager who was working on the project. And again, even when we had another vendor, which was Availity, they're willing to help us with that relationship, be the middleman, put together the requirements instead of putting that back on us as a plan to have to lay out and keep track of. They were really saying, let me schedule that meeting. Let me get everybody the right people in the right room at the right time. Let us put together the documentation and share that with Availity. So they really didn't make it to where Blue Cross Blue Shield of Wyoming had to offer this IT infrastructure or someone to say, how do you code this? How do you implement this? They really came to the table and said, we're going to make this work, and whatever we need to bring to the table, we will bring that to the table. And so I think that really helped us to have those expedited timelines and to make sure that we met those timelines.
And then another question that we often get is, why can't we build this ourselves? Isn't this just a database with a few tables that determine whether or not prior auth is needed? What are your comments as it relates to that question?
To be honest, we tried and we failed. That is where we were for years. I think when it's simplistic and it's just one CPT code, and if it was the same for all lines of business, I think it would be simple. It is a table. But when you start talking about the complexities of selling multiple lines of business, if you're a payer and have self-funded clients who can write their own rules and change them at any time, you're working with governmental programs, Medicaid, Medicare, federal employee program. Basically, you're trying to find the right answer and display it. But again, those things change so frequently. And so just the maintenance of it, maybe you can build it, but maintaining it is extremely difficult. Itiliti was able to find a way to take the data we had today from our claims processing system and say, here's our rules, and take that, ingest it, and display it. So for us, it was a very simplistic process to say, we have this somewhere, we just don't have a way to display it and maybe maintain it in another place. And so they really brought the claims processing to the authorization process and married it up for us. And that was a huge win.
And another question here from an attendee is, was there an integration process with your authorization or care management system? And I guess we're talking about Availity in that case, as well as maybe a care management system.
Yep. So the way that it works today in our process is that our providers, if they're doing this electronically, go to Availity, they go to the PA checkpoint tool, and if it says yes, it provides them then a link to enter into our authorization submission screens, and then they can enter that. It comes into our care management system, and they receive their approval or denial. If they are using fax, phone, or some other paper mechanism, they can use the PA checkpoint tool and then submit those forms to us. We don't have it directly integrated into our case management, disease management, or utilization management tools. We as a plan have not found that we needed to do that. And the reason being is that our authorization rules of just, does it require auth or not, was not an integrated point in any of those software pieces. We have found as we move towards 2026 regulations that there might need to be some integration points. We may need to marry up some of that data. However, today we haven't had that need. But Mike, I'm sure you could talk about what would that look like if a payer or a provider wanted to link that to a new software system, maybe that you haven't worked with before.
Yeah, our architecture is a fairly new architecture as a platform. And so all of the different modules within Itiliti Health's software tools talk to each other using APIs. So that means that there are readily available APIs to connect to any other tool at any point in the workflow within Itiliti Health. So we have a lot of abilities to connect, to capture rules or other pieces of information, member lists or group directories and things like that, that can be done intermittently on a live basis or through other means. I think that's, again, one of the strengths of our solution is that we've tried to meet the health plan where they are in terms of the level of complexity and sophistication they want to get to in terms of integration. So that's the end of the questions. And Amy, we really appreciate the opportunity to talk with you today. It's been super helpful to hear your perspective on your implementation of PA Checkpoint. And I'd encourage anybody that would like to get back to us with any additional questions. I'm sure we can route those to Amy if there's any specific questions that need to be asked via email. So thank you again, Amy, and thank you to everybody who attended. We appreciate the time today.
I just want to remind, oh, sorry, Amy. I just want to remind everyone that the slide deck and recording will be posted on the ACAP website by tomorrow morning. Thanks again and stay safe.
All right. Have a good day.